Well, considering I have no routine in my life.
Yeah,
and
absolutely.
I'm always on the go.
Yeah.
I get messages on a daily basis asking how do you cope, like managing, and I think I do really well, considering where I was when I first started in the entertainment industry. I think my HbA1c went up to like 10.
Yeah.
Where now, like I've really, I think, got to grips with my body.
Yeah.
And what I can and can't do.
And it's having the education, isn't
Absolutely.
it? It's knowing, and once you've got those skills, you know, and I always feel so bad for diabetic patients. I really do. You get absolutely hammered.
Yeah.
If it's not your feet, then it's your eyes.
Absolutely.
You know, there's always something that you need to be
looking at
and keeping a check on.
Yeah.
But this is why we've kind of set up this diabetic care within Queensway Dental, is because we're finding that people they don't know about their mouth.
No.
They don't know at all, and they don't know about the gum health, and there's things that can go wrong for you guys, like I say, very, very quickly. So that's the problem. When people have gum disease, I think it's about 80% of adults at some point will get gum disease. You know, so we're all susceptible to it. It just means you guys are just that little bit more susceptible to it. And the trouble with gum disease is it doesn't always hurt. So it can be going on, nobody knows. And this is the thing, if nobody's checking your mouth regularly, that can be silently going on, causing problems. And the trouble is when you've got gum disease is totally reversible, by the way. Come in, have your teeth cleaned by a hygienist or therapist, get them cleaned. We go over your education with your little brushes and your electric toothbrushes and what have you. And literally, within a couple of weeks, you can have it turned around. So the one thing you're going to see with gum disease is when you're brushing your teeth, you spit out, there's blood.
Yeah.
Or if you're using your little interdental brushes, there's going to be blood there.
Yeah.
So we don't want blood on with any patient, but definitely with diabetic patients, any bleeding, anything like that, goes to your dental team.
Yeah.
Needs sorting out, needs nipping in the bud quickly. Because what will happen is it goes on to the next stage, which is periodontal disease.
Okay.
Periodontal disease, again, is silent, it's not painful. So you can go from one to the other very quickly. Right. Especially if you're an uncontrolled diabetic.
Right, okay.
So if you go on to that stage, what tends to happen doesn't just affect the gums, it then affects underneath, so the foundations, so the bone around the teeth. So if you have someone with implants or something like that, you know, we need that bone there. We need it to be rock solid to hold those implants in place. So the bone, it does affect the bone, and the bone can just sort of resolve down. Okay, and all the little ligaments that hold the gum and the bone together. Then you wind up with wobbly teeth. Okay, which is never a good thing in anybody, you know, or you wind up with infections, and you know yourself, Amelia, with infections of any kind in a diabetic patient is not good news for you.
100 times worse, isn't it?
Absolutely. It's more severe, it's harder to get rid of, and it plays havoc with your glycemic control as well. I know.
That's why I don't have any of that.
So, but on a positive note for you guys, if you've got good oral hygiene and you've got you're coming in and you're getting your gums checked regularly, this isn't going to be a problem for you as long as you keep the glycemic control. So you do those three things. Okay. The problem with periodontal disease is it is like a little ulcer. If you think of an ulcer underneath the gum, so in what we would call a pocket. So if you have that, if your mouth is full of these little gum abscesses, if you like, if you added all those together, it would be the size of your hand. So you would have an ulcer the size of the palm of your hand. Crazy. And it's going undiagnosed, you know, so your diabetic teams don't know about it because they're not looking in your mouth. You guys don't know because it doesn't hurt. You might get a funny taste from it time to time, but the main thing you would find is your teeth would eventually go wobbly.
Oh God!
You see how important it is now? So we're trying to, like I say, catch you guys before it becomes a problem. If we could do that, that's my job done. I'll be happy with that. But we do have a section of patients that do need a bit extra help.